Marie-Pierre, how are the services structured in Canada?
Globally, Canada is a federation. So there's a health ministry at the federal level, but most of the healthcare decisions and structures are taken at the provincial level. So there are 10 provinces and territories as well. So each province has a health ministry that decides upon the structure, and most of the laws, regulations are made at the provincial level. At the federal level, it's mostly concerned about public health, general security and protection for individuals, regulation about drugs and other devices, but decisions are really decentralized in Canada. So even in each province where you have the Ministry of Health, you have also regional authorities that can be responsible for service delivery to organize at this regional level. So it's very broad country and a lot of structures for decisions.
What is the penetration of electronic health records?
I would say that it's getting better. We used to be lagging behind a lot compared to other countries, European countries, or even the United States. But during the 2 last years, we have had a larger penetration of electronic medical records, so mostly in private primary care practice. And now we reach 60% of penetration in general. In Quebec, where I'm from, it's a bit lower. But the Ministry of Health has implemented an incentive support for these primary care doctors, and in the clinics now they can have funding to implement medical records. But my work is mostly on personal records that are for patients, and this is still very slow because we first need to have a good electronic record system, and then to implement the patient part of the record, the part that the patient can actually control, consult, provide data in order to track their diseases. So that's my main interest, is how to integrate the personal health record with the electronic medical record or electronic health record, which is a broader record that will not only include the medical record that is from primary care, but also hospital records and all the information that an individual can have within the healthcare system, including medication, consultation with other specialists as a physiotherapist or nutritionist.
Please describe sample projects.
There are a lot of small-scale pilot projects in Canada regarding electronic personal health records, but there's one that I'm particularly involved in, and it's a project that aims to link the patient personal health record. It's called My Personal Virtual Primary Health. It's kind of a portal that the patient can manage, and then it's linked with the medical electronic record, and it's done mostly for people with chronic diseases, diabetes, heart failure, and COPD. And also, that is the interesting part in it, for parents with child that have attention disorders and some problems like that. So in one instance, the patient controls their own data regarding their chronic disease, and the data is sent to their medical doctor, who can then analyze it. And on the other side, the parents of the little children can also include their data about their child.
What is your involvement at Med-e-Tel?
Here I'm mostly here to present some of our work, including the poster. It's an environmental scan of all the projects with electronic personal health records in Canada. And I'm also presenting an oral conference that is more about a theory to predict adoption of electronic medical records by physicians. And I'm also there for networking. So here, Med-e-Tel, it's the greatest conference to meet people involved in telemedicine, e-health, mostly from Europe, but also international. I've seen there's a lot of international participants, so I'm really there to meet people and eventually build collaborations for future research projects.